Good morning, I'm Dr. Sanjiv Gupta, Senior Interventional Cardiologist working at Muscat Private Hospital. Muscat Private Hospital is a very renowned hospital which has been working, oldest hospital in the private sector, and I've recently joined it. I myself am an interventional cardiologist working for the last 25 years with experience both in the coronary and the structural field. My training has taken place in France, where I've got trained in coronary interventions and structural procedures like TAVR, LA appendage closure, PFO closure and mitral clip. At MPH, the cardiac division consists of non-invasive and invasive facilities. The non-invasive facilities include echo, treadmill, dopamine stress echocardiography, BP monitoring, while the invasive department consists of a dedicated cath lab where we practice interventional procedures, coronary angiographies, coronary angioplasties, electrophysiological procedures like pacemaker implantation, pediatric procedures, and even peripheral interventions. We are the only hospital in Muscat which gives 24 by 24 hour services, chest pain services, and we regularly do primary and rescue angioplasties for our patients. The hospital is in the process of upgrading its services, and we wish to introduce structural procedures like transaortic valve replacement, PFO closures, LA appendage closures, and as this upgradement takes place, we will be offering these services to our patients on a regular basis. The team of cardiology consists of 2 consultants, 1 specialist, plus ancillary staff for supporting us on a regular basis. We are grateful to the entire team of Muscat Private Hospital, the ER department, the anesthetic team, and other departments which provide support to us and help us in doing our services and providing care to our patients in a smooth and efficient manner. Thank you very much.